Bicep tenodesis is a proven method for treating anterior shoulder pain due to biceps tendinopathy. Multiple techniques are currently available for achieving tenodesis, including open and arthroscopic procedures and the use of screws or sutures for fixation. But it remains unclear which technique offers the best clinical outcomes for patients. To provide some clarity, researchers compared 4 fixation constructs: open subpectoral tenodesis via interference screw, or one single suture anchor, and arthroscopic suprapectoral tenodesis via interference screw, or 2 single suture anchors. Performance was measured radiographically based on the distal migration of the biceps tendon after surgery, monitored using a tantalum bead. Patient-reported outcomes were also collected. Results were obtained for 94 patients at 1 week and 12 weeks after surgery. The lowest amount of tendon migration was recorded for fixation with an interference screw, with no difference observed between the open and arthroscopic approaches. Much greater migration, however, was observed with suture anchor fixation. Significantly, more migration was associated with the use of a single suture anchor versus an interference screw, both at 1 and 12 weeks after surgery. While significantly more migration was observed only at 1 week when using 2 suture anchors versus an interference screw. Despite these variations in migration, no differences were observed in patient-reported outcomes, as measured by the CMS, SANE, and PROMIS-UE instruments. One limitation of the study is that some tenodesis techniques involved unique surgical procedures performed at the same time, such as debridement during the open procedures, which could signify differences in healing. Another factor that may have affected healing is that patients undergoing open tenodesis with one suture anchor were, on average, 10 years younger than patients in any other group. In addition, with regard to bead placement, it is possible for some loosening of the beads used to track migration to have affected the final results. Overall, the findings indicate that less tendon migration may occur with either open or arthroscopic biceps tenodesis when using an interference screw versus sutures for fixation. And when using sutures for fixation, it's possible that migration may be minimized by utilizing at least 2 anchors.